Hello, this is Dr. Mubashir Ali, Senior Consultant Internal Medicine, Apollo Telehealth. Today's topic of discussion is monsoon diseases. So, as we all are aware that we are in the midst of the monsoon season in India, and with this brings many monsoon diseases, seasonal diseases. So we are going to learn about different monsoon diseases and how to be careful, how to take precautions, and what are the different management aspects of these diseases. So what actually changes the plot in the monsoons? So there is drastic change in the temperature and humidity. This leads to more easy growth and survival of different microorganisms and germs, and there is high chance of contamination everywhere. So the transmission of all the germs through food, air, water, hands, unhygienic hands, flies, mosquitoes increases with this. So along with these, it brings the monsoon brings the risk of catching various illnesses due to the unhygienic conditions all around, and due to insufficient preventive and public measures taken place during monsoons. So what are the commonest monsoon diseases? We usually categorize broadly into three types of monsoon diseases. The first one being mosquito-borne. So malaria, dengue and chikungunya are mosquito-borne diseases usually seen in the monsoons. Next one is waterborne. They are diarrheas and stomach infections, hepatitis, particularly hepatitis A, cholera, typhoid and fungal infections. And the next category of diseases usually seen in monsoons are viral fevers, flus, which are very common in this season, allergic asthmas, and COVID-19. As we all are aware, for the past 2.5 years, we have been facing the brunt of COVID-19. So both the extremities of ages, that is children as well as old age, are more prone to get affected in monsoons because of the more easier transmission of the diseases, lower immunity levels during this disease, and due to high sensitivity of the body to various infections, they become more susceptible. So the first set of disease which we are going to discuss in detail is malaria. Malaria is a parasitic infection transmitted by Anopheles mosquito that leads to acute life-threatening diseases. So there are total five species of Plasmodium causes infect humans with malaria: Plasmodium falciparum, ovale, vivax, malariae and knowlesi. So fever with chills and rigor is the most dominant symptom in malaria. So fever could be there for 7 or more days, and along with fever there could be symptoms including headache, malaise, weakness, gastrointestinal distress could be there, upper respiratory symptoms also would be there, and muscle aches. And severe cases may include clinical jaundice, confusion, seizures and dark colored urine. And the physical exam may reveal a febrile, ill-appearing patient with possible hepatosplenomegaly. There could be icterus, that is clinical jaundice, pallor, and there could be signs of dehydration as well. Severe muscle aches, body aches may display hemodynamic instability. Somnolence could be there. There could be clinical coma, particularly in those with concomitant bacterial infection or malaria-induced adrenal insufficiency. So severe presentation of malaria is usually common in the species of Plasmodium falciparum. So the initial evaluation of undifferentiated fever in stable patients with possible malaria exposure includes a typical complete blood picture, comprehensive metabolic panel, coagulation panel, blood culture, urine analysis, chest radiograph, and most important is the thick and thin blood smears for detecting malaria parasite. So the treatment of the patients diagnosed with malaria includes schizonticidal medications, supportive care, and hospitalizations for severe malaria or for the high risk patients. So treatment involves combination therapy targeting both the hepatic and erythrocytic forms, and the chief antimalarials are chloroquine, hydroxychloroquine, primaquine, artemisinin based combination therapy, and atovaquone and proguanil. And usually the significant complications of malaria are cerebral malaria and metabolic encephalopathy, anemia, and there could be kidney disease, malaria induced kidney disease or nephrotic syndrome. And the next set of disease which we are going to discuss today is diarrheas. So the main symptom of diarrhea are passing watery stools 3 or more times per day. The other associated symptoms could include mild fever, there could be dehydration, nausea, abdominal discomfort, and there could be occasional stomach cramps as well. So these loose stools last for more than 3 days, and these are usually infective in nature, usually self-limiting. Dehydration and malabsorption can be serious complications of diarrhea across all ages. Usually 3 types of infections cause diarrhea. One is viral infections, the second is bacterial infections, and the third is parasitic infections. And diarrheas usually stop with simple hydration measures, oral rehydration therapy, fluid-based dietary plan, and other home remedies. So use of an unimproved water source or unimproved sanitary conditions and extreme rainfall events during the rainy season are each associated with the cause of diarrhea. So the next disease which we are going to discuss is typhoid. So typhoid is also a waterborne disease caused by Salmonella typhi. This is mostly encountered in developing countries where people have restricted access to clean drinking water, and typhoid is often associated with fever, muscle pain, sweating, and constipation. And the typical step ladder pattern of fever is significant to typhoid. There could be abdominal pains, there could be changed bowel habits. So as the infection progresses, there is loss of appetite, there could be diarrhea. Some people may also develop a skin rash in typhoid. So usually blood tests that are significant are blood culture, stool culture, Salmonella antibodies, and there is also a Salmonella antigen detection test called VIDAL, and these are the few important investigations advised. So typhoid can be dangerous if there is blood in the feces, and typhoid fever requires prompt treatment with antibiotics. If typhoid fever is diagnosed early, the infection is likely to be mild and can usually be treated at home with 7 to 14-day course of antibiotic therapy. So more severe typhoid fever usually requires admission into a hospital so that injectables can be given, and with prompt antibiotic treatment most people will start to feel better. The symptoms will subside without any serious complications. So if typhoid fever isn't treated, the symptoms will continue to get worse over the following weeks, and the risk of developing potentially fatal complications will also increase. So safe drinking water, hygienic sanitary conditions, and avoidance of overcrowding contribute remarkably to the reduction of number of typhoid cases. So next disease is hepatitis. So usually there are many causes for hepatitis, but the major cause for hepatitis is viral cause. So there are usually 5 kinds of viral hepatitis: A, B, C, D, and E. The most commonest ones in India are hepatitis A, B, and C. So viral hepatitis are a group of infectious diseases affecting and causing inflammation of the liver, and these usually affect millions of people worldwide and India, causing both acute, that is short-term disease, and also chronic, that is long-term liver disease. So what is hepatitis A now? Hepatitis A is a viral liver disease that can cause mild to severe illness, and the hepatitis A virus is transmitted through ingestion of contaminated food and water or through direct contact with an infected person. And usually hepatitis A is most commonly transmitted through oral fecal route via exposure to contaminated food, water, or close physical contact with the infectious person. So what are the symptoms of hepatitis A? They usually range from mild to severe: fever, malaise, loss of appetite. There could be diarrhea, nausea, abdominal discomfort, There could be dark colored urine, obviously due to the hepatitis. There could be clinical jaundice, that is yellowish discoloration of the skin and sclera. So hepatitis A does not cause usually chronic liver disease, unlike hepatitis B and unlike hepatitis C. Acute hepatitis is usually present as a self-limiting illness, and development of fulminant hepatitis A is very rare. So the acute hepatitis A is usually diagnosed by serological testing to detect HIV specific immunoglobulins, antibodies in the blood. Additional testing can include a reverse transcriptase polymerase chain reaction to detect the viral RNA. Blood work will reveal a mild lymphocytosis, normal prothrombin time. If the prothrombin time is elevated, it should raise suspicion of severe liver damage due to hepatitis A. So hepatitis A is also associated with elevation in the liver enzymes such as aspartate aminotransferase, which returns to normal in 4 to 6 months. So bilirubin levels are also elevated, and if they persist, one should suspect cholestatic liver disease. No specific treatment is needed for most of the patients with acute uncomplicated hepatitis A infection. So they just need supportive care and symptomatic treatment. Complete recovery from symptoms may take several weeks to months. In rare cases, there could be fulminant hepatitis infection due to hepatitis A. And in these cases, usually liver transplantation is the only life-saving measure. And extrahepatic complications are usually managed routinely with supportive care. Vaccination against hepatitis A is recommended for children 12 months or older and adults with the risk of exposure, including travelers to endemic countries, to endemic areas, men who have sex with men, illicit drug users and abusers, potential occupational exposure, and chronic liver disease. So how to prevent hepatitis A? So the spread of hepatitis A can be reduced by adequate supply of safe drinking water, proper disposal of sewage within communities around you, personal hygiene practices such as regular hand washing and drinking of safe water. And few important points to remember are that both hepatitis A and hepatitis B are completely preventable with safe and effective vaccines, and hepatitis C is curable with prescribed antiviral medication. So the next disease which we'll be discussing today are viral flus. So we usually encounter a lot of viral flus during monsoon season. So viral flu is a communicable viral disease that affects the upper respiratory tract, including upper and lower respiratory passages. A wide spectrum of influenza viruses causes these kind of viral flus, and some of these viruses are lethal. So what are the signs and symptoms of influenza? There could be cough, fever, sore throat, myalgia, headache, runny and stuffy nose, congested eyes. A frontal or retroorbital headache is the most commonest presentation with selected ocular symptoms that include photophobia and pain with different other symptoms. So influenza spreads rapidly and efficiently in seasonal epidemics like rainy season. So flu epidemics occur every rainy season and winters in temperate regions and affect a significant portion of population, and both adults and children are equally affected. So this is also a self-limiting disease, and the gold standard for diagnosis is the RT-PCR test or viral culture of throat secretions. But usually viral cultures and all, they take a few days to yield the results. Vaccination is highly recommended at the start of the rainy season or the winter season. The flu vaccine recommendations include all individuals aged 6 months and older. The flu vaccine can also be administered to pregnant women. While the flu vaccine is not 100% effective, it can lower the intensity and duration of symptoms in most people. So individuals who have lung diseases, diabetes, hypertension, cardiac diseases, chronic illnesses, the elderly and children should get the flu vaccine, as it can prevent admission during this flu season. The key is patient education about vaccination. All patients should be encouraged to get the annual flu vaccine that is available each year, and all the different strains are included in the flu vaccine every year. Simple remedies usually are helpful in treating influenza, because it is a self-limiting disease, and this is usually mild in most healthy individuals who do not have other comorbidities. No antiviral treatment is usually needed during mild infections in healthy individuals, and antiviral medications can be used to treat or prevent influenza infection, especially during outbreaks in healthcare settings such as hospitals and communities. Oseltamivir, zanamivir, and peramivir belong to neuraminidase inhibitors family and can be used for the treatment of influenza A and B. So the next important disease which we usually encounter in rainy seasons are dengue fever. Dengue is a mosquito transmitted virus and the leading cause of arthropod-borne viral disease in the world. It is also known as breakbone fever due to the severity of muscle spasms and joint pains, and it is also a 7-day fever because of usual duration of the symptoms. Although most cases are symptomatic, severe illness and death may also occur. So dengue fever is caused by any of the 4 distinct serotypes of DenV124. It is a single-stranded RNA virus of genus Flavivirus. So 2 transmission cycles maintain the dengue virus. Mosquitoes carry the virus from a non-human primate to a non-human primate, and mosquitoes carry the virus from human to human. The 3 phases of dengue include febrile phase, critical phase, and recovery. So during the febrile phase, there is sudden high-grade fever that usually lasts 2 to 7 days. And the type of fever is saddleback or biphasic fever in approximately 16% of the cases. And it is described as a fever that remits at least for 1 day, and the next fever spike starts, which lasts at least for 1 more day. Associated symptoms include of this febrile phase include facial flushing, skin erythema, myalgias, arthralgias, headache, sore throat, conjunctival infection, anorexia, nausea, and vomiting. So all these could be seen. Common laboratory findings include thrombocytopenia, there is decreased platelet count. Leukopenia could be there, elevated aspartate aminotransferase enzyme in liver function test. What are the warning signs of dengue? The warning signs are abdominal pain, persistent vomitings, and clinical fluid accumulation such as ascites or pleural effusion, mucosal bleeding, lethargy, liver enlargement greater than 2 centimeters, increase in hematocrit in the complete blood picture, and thrombocytopenia. Severe dengue fever with severe plasma leakage, hemorrhage, organ dysfunction including transaminitis greater than 1000 international units per liter, impaired consciousness, myocardial dysfunction, and pulmonary dysfunction. These are included in severe dengue. What are the warning signs for dengue shock syndrome? The symptoms include rapidly rising hematocrit, intense abdominal pain, persistent vomiting, and narrowed or absent blood pressure. The virus antigen is detected by ELISA, polymerase chain reaction, or virus isolation from body fluids. Serology will reveal a marked increase in immunoglobulins. A confirmed diagnosis is established by culture, antigen detection, or polymerase chain reaction, or even serological testing. So those presenting early without any warning signs can be treated on an outpatient basis or at home with normal supportive care and symptomatic therapy. And patients with warning signs, severe dengue or other situations like infancy, elderly, pregnancy, diabetes, other comorbidities, and those living in unhygienic conditions probably will need admissions. So these can be managed with IV crystalloids, and the fluid rate is titrated based on the patient's response. Colloids can be started for patients in shock and are also preferred if the patient has already received previous previous boluses of crystalloids who have not responded. Blood transfusion is usually warranted in case of severe bleeding or suspected bleeding when the patient remains unstable, and if the hematocrit keeps on falling despite adequate fluid resuscitation measures. So platelet transfusion is considered when platelet count drops to 20,000 or lower and there is high risk of bleeding. So usually one has to avoid giving aspirin and non-steroidal anti-inflammatory drugs and other anticoagulants during this phase. And there are no prescribed or no antiviral medications that are useful in dengue. So how to prevent dengue? Usually mosquito nets during sleeping, especially at evenings. Usually these dengue, the mosquitoes which transmit dengue are usually more common during daytime, and destroying the habitat of Aedes mosquito. Vaccination against dengue, which is very much available, using mosquito repellents and using anti-mosquito creams while sleeping. These can prevent the infection of dengue. The next set of disease is chikungunya. So chikungunya virus is an alpha virus that is arthropod borne and transmitted again by Aedes mosquitoes. These viruses cause a rash, acute febrile illness, arthralgia known as chikungunya fever, which can develop into potentially chronic and debilitating arthritis that may last for months and years. Chikungunya fever usually presents with the non-specific findings of high-grade fever, myalgias, arthralgias, followed by bilateral symmetrical polyarthralgia, preferentially involving distal over proximal joints. Another commonest clinical manifestation is a generalized maculopapular rash that usually involves the extremities first, and it spreads to other parts, and this usually is seen in 3 days after the fever symptoms. So other manifestations such as abdominal pain, diarrhea, vomitings, and generalized lymphadenopathy can also be seen. So usually the diagnosis of chikungunya virus is usually by detection of viral RNA with serology or reverse transcriptase polymerase chain reaction, depending on disease time frame presentation. And symptomatic relief is the mainstay of treatment for chikungunya fever. There are no antiviral medications, and adequate hydration has to be there, rest, and symptomatic treatment with the paracetamol or acetaminophen. Chronic manifestations including persistent or relapsing remitting polyarthralgias, polyarthritis, myalgias have been found to be responding adequately to HCQS in combination with corticosteroids or other disease modifying drugs. And so this is about chikungunya. The next important disease which we need to discuss is COVID-19. It is still seen now even after 2.5 years. So this is a highly contagious infectious disease caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. So there have been many variants: alpha, beta, gamma, delta, and now presently Omicron is the most commonest variant that is encountered in India presently. So the primary mode of transmission, as we all are aware, is via exposure to respiratory droplets carrying the infectious virus from close contact, or droplet transmission from pre-symptomatic, asymptomatic, or symptomatic individuals harboring the virus. And there is indication of airborne transmission with aerosol generating procedures have also been implicated in the spread of COVID-19. Fomite transmission is also seen, and based on the severity of presenting illness, that includes clinical symptoms, laboratory and radiological abnormalities, hemodynamics and organic function. The ICMR has divided the types of infection into three types, that is asymptomatic or pre-symptomatic infection, mild illness, moderate illness, severe illness, and then critical illness. Severe illness are the patients who have SpO2 of less than or equal to 94% on room air, and critical illness patients, individuals who have acute respiratory failure, septic shock, multiple organ dysfunction. So these patients with severe COVID-19 illness may become critically ill with the development of acute respiratory distress syndrome, which tends to occur approximately 1 week after the onset of symptoms. Although COVID-19, the illness is caused by SARS-CoV-2 virus, predominantly affects the respiratory system. COVID-19 can be considered a systemic viral illness, giving the multiple organ dysfunction associated with the illness. So let's also quickly go through about monkeypox, because there is a panic because of the recent surge in the monkeypox cases in India. So monkeypox is a zoonotic orthopox virus that incidentally causes diseases in humans similar to smallpox. Although with notably lower mortality, this virus is clinically relevant because it is endemic to Western and Central Africa. So initial symptoms include fever, headache, myalgia, fatigue, and lymphadenopathy. A key differentiating feature of monkeypox from the smallpox, usually the symptoms are very much similar to smallpox. After 1 to 2 days, there are mucosal skin lesions which develop in the mouth, closely followed by skin lesions on the face and extremities, including palms and soles, and are centrifugally concentrated. The rash may or may not spread to the rest of the body, and the total number of lesions may vary from small amount to thousands of lesions. So usually monkeypox infection can be conferred via isolation in the viral culture or RT-PCR for monkeypox DNA detection. So these are the common investigations. Currently, there are no specific clinically proven treatments for monkeypox infection. As with most viral illnesses, the treatment is supportive and symptomatic treatment. There are, however, preventive measures that can help prevent an outbreak. And this is also usually a self-limiting disease, and the disease duration could be around 2 to 4 weeks. So the infected individual should remain in isolation, wear a surgical mask, and keep the lesions covered as much as reasonably possible until all lesions and crusts and scabs have naturally fallen off and new skin layer has formed. For severe cases, investigational use can be considered for compounds with demonstrated benefit against orthopox viruses or the agents which were used in in smallpox. So this is briefly about monkeypox. So what are the important sanitation tips which one has to be aware of? So stagnant water can be a breeding ground for mosquitoes and parasites. Ensure that you empty all tanks of stored water. You need to empty the water coolers, flower pots which are filled with stagnant water, and use of repellents containing DEET, which is a chemical compound. Wearing protective clothing, full sleeve clothing, bed nets are important, and these are few important measures to prevent exposure. Furthermore, prevention of mosquito proliferation should be implemented by reduction of peri-domiciliary water puddles. Insecticides have been another means of vector management, using 4 types of insecticides such as carbamates, organochlorides, organophosphates, pyrethroids, which can be sprayed in and around the unhygienic areas and water puddles. So make sure you drink clean water during monsoons. So you need to load up on probiotics, and fresh vegetables are important. Avoid street foods and outside foods. Do not overeat, and stick to eating small meals each every few hours to maintain that level of hydration. So rainwater might be harmful when you're going out. Make sure that you protect yourself from the rainwater, because these contain pollutants and dirt that get trapped on the skin and hair, and that might cause various other skin related illnesses. You binge on immunity boosting fruits. So an apple and day can really help you clean up the toxins present in the liver and boost your immunity. Including vitamin C rich fruits like oranges, sweet lime is considered one of the healthiest ways to boost immunity and fight infections in rainy seasons. So usually fruits are rich natural sources of vitamins and minerals that are essential for an individual to maintain health and strength during rainy seasons. And try to drink warm water every 2 hours, and carry home boiled water while traveling. Avoid visiting crowded places such as theaters, malls, or other crowded public places. Use hand sanitizers and while traveling, or usually frequently wash your hands. Cover your nose while traveling on a bike, or while seated next to a window in a bus or train. So prioritize your health and do not delay the diagnostic tests. For example, if you have comorbidities and you need to get tests done from time to time, so go for them, don't delay. A wise way to identify any symptom and nip them in the bud before they get too serious is to get your preventive health checkups regularly, particularly during these monsoons, because usually these conditions, the humid conditions, the survival of the microorganisms, they decrease the immunity levels. So how to quickly learn about improving immunity during monsoons? So usually nutrients essential for building immunity are the building blocks of the body. When consumed on regular basis in prescribed amounts, can lead to toughened immune system. And vitamin C, as I've just discussed, the most important is vitamin C, which is an antioxidant. It fights free radicals that are capable of damaging the immune system, especially in people who work in high stress environments and who are more susceptible for diseases, so particularly in rainy seasons. So immune boosting vitamins like vitamin C intake can be increased by eating citrus fruits such as orange, kiwi, red and green peppers, and broccoli and other green leafy vegetables, strawberries too. So one more important vitamin is vitamin E. So try to consume more almonds, sunflower seeds, hazelnuts, etc., which are full of vitamin E that help maintain the immune system and boost it. Especially these are helpful in the elderly. It is also found in wheat germ oil. So that is again one of the important factors. Zinc needed to produce certain immune cells is an essential component of many foods that boost your immune system, like cashews, chickpeas, baked beans. So low levels of zinc definitely in the body impair the immune system. One more important factor for boosting immune system is carotenoids. These are plant pigments which when consumed convert to vitamin E. Foods rich in carotenoids are carrots, apricots, papaya, mango, etc. And omega-3 fatty acids are again immune boosters. So these are the type of essential fatty acids known to suppress inflammation. They boost up the immune system. These are found in oily fishes such as salmon, tuna, trout, herring, etc. One should eat more omega-3 rich flax seeds and walnuts to help keep the immune systems in check. So home remedies such as garlic and ginger are also helpful to boost the immune system. One more home food is chia seeds. So these are also rich in omega-3 fatty acids. So blueberries, they are rich in vitamin C and potassium, which are helpful in treating the inflammation and all. So yogurt again contains helpful germs called probiotics, which live in the gut and improves metabolism, and this fights the stomach infections and all. So these are some of the measures which one has to take and one has to eat to improve the immune system. So I end this discussion here. Hopefully this is useful for all of you, to know about certain monsoon diseases, how to take care against them, how to prevent them, how to treat them. Thank you once again.